Hello, I'm Kate. I'm your nurse practitioner today. How would you like to be? Hello. How would you like to be addressed?
You can call me Bobby.
All right, Bobby. Sounds good. Today we're going to examine your heart and lungs. I'm going to be listening to your heart and your lungs. I'm going to have you in a couple different positions, and I'll be touching your neck, chest, and feet. Do you have any questions?
No.
All right. I'm going to begin by palpating your carotid artery on both sides. Now I'm going to listen for what's called a bruit on either side on your carotid artery. So as I listen with the diaphragm, I'm going to have you inhale and hold your breath. Okay, you can exhale. Now just a short inhale and hold. Thank you. I'm going to begin by, I'll have you remove your shirt in a real exam, but for the purpose of this video, we'll keep your shirt on, respect your privacy. I'm inspecting your chest and looking for any heaves or lifts, which I do not see. And I'm looking at an apical impulse. It'd be possibly around your fifth intercostal space, midclavicular line. I don't see anything obvious. I'm now going to listen. Nope, I'm going to palpate first. Palpating your aortic area for any thrills, and pulmonic, mitral, tricuspid, and then mitral. And while I'm here, I'm going to look for that fifth intercostal space and listen for the PMI, or feel for the PMI, the maximal impulse here. And it is right about the fifth intercostal space, midclavicular line. Now I am going to listen with both sides of my stethoscope, the diaphragm first. I don't hear any S3 or S4 sounds. I'm going to be listening for murmurs as well as I use the bell of my stethoscope. I hear S1 and S2 with no murmurs or extra heart sounds. Next, I'll have you lay on your left side. Sam. And again, I'm listening for S3 or S4 or murmurs as I listen over the tricuspid and mitral areas. Thank you. I'll have you sit back up. And with your legs down, thank you. I'll have you lean slightly forward. Now listen again over the apical and pulmonic areas. Okay. And considering your peripheral vascular system, I'm looking at you to observe if your lips are blue, which they are not. And I'm going to feel your radial pulses. Thank you. While I'm at it, I'm going to check your pulse. Great. Right at about 100 actually. And now put your hands straight out. I'm looking for any clubbing, which I don't see, in cap refill. Also the temperature is equal. And I'm going to feel your dorsalis pedis pulses and your posttibial. And I'm checking for any edema on your legs, which I do not see. I ask about calf pain at any rate. Now for your pulmonary exam, as I'm watching you, I'm looking for even unlabored breaths and signs of anxiety or pursed lip breathing, which I don't see. Your inspiration to expiration ratio seems to be normal. Looks like it's about 1 to 2. And I will take a listen to your lungs. We're still recording. Great. Listening, so you can just breathe like this. Listening at vesicular sounds. If that's too fast, if it's uncomfortable, you can breathe slower. Vesicular sounds, and then this is the bronchial sound, which is a little bit more harsh. I don't hear any wheezes or rails. I'm going to listen on your backside as well. Bring this over. Thank you. Didn't hear any crackles or wheezes. Okay, well that will end our exam for today. Do you have any questions?
Nope.
Okay, I'm going to look over my notes. I'll be back in a little bit.
Thanks.
Thank you, Bobby.